This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, my video is not working right now. The host shut me down. This is Mike Andery, Dr. Andery. I am the program director for now I can start it. Thank you. I get kicked out of places all the time. So we are the old Michigan State University program, and much to my chagrin, in a way, our hospital was taken over and merged with University of Michigan. So now we are the University of Michigan Health Sparrow / Michigan State University Physical Medicine and Rehabilitation Residency Program. So it's kind of weird that we changed our name this year, and it's even weirder that Michigan State program is now a University of Michigan at the start. So I have green blood, which is Michigan State, obviously, and I never thought I'd work for University of Michigan, but in the big picture, it's been a good thing for our program to, if we're going to get taken over by somebody, I'd much rather be taken over by University of Michigan. I mean, they are mission driven. They understand research. They understand patient care. They understand teaching. So overall, so far, it's been good. And the decisions that they've been making, in my view, have been good. We will be a separate GME, graduate medical education. So I don't think the residencies will ever merge. There's no plan to do that in the next 5 to 10 years. And so I think they'll remain separate. And, geographically, we're over an hour away from each other. So I don't think they'll be merged. You want to go to the next one? We do have multiple, next slide, if you don't mind, so that's University of Michigan and that's Michigan State. The faculty are employees of Michigan State University College of Osteopathic Medicine. So I've been an employee there for over 25 years. Our rehab floor is merged with, it's a joint venture with Mary Freebed at Sparrow. And so we've been doing that for about 10 years. And our residents rotate for 3 months at Mary Freebed in Grand Rapids. We also get funding and are affiliated with McLaren Hospital System, and McLaren has hospitals in Flint that we go to and a hospital in Lansing. So that's the geographic locations of our program. And I think I'm done, Dr. Ackers.
Hi, everybody. Hope you can hear me. Oh, we're good. Okay.
Yep.
My name's Cole Wesselman. I'm a PGY2. I am new to Michigan, but I'm going to talk about it a lot. We do a few different rotation sites here. We are mainly out of University of Michigan Health in Sparrow in Lansing. We're only about a 10-minute drive from McLaren Hospital. And then about MSU, about 12 minutes or so, where we do some outpatient clinics. We also go over to Flint. From the hospital, it's about 45 to 50 minutes. A lot of the residents like to live really close to the hospital, so it's a quick jaunt over to the Flint area. I just came from the pain clinic last month there, and I'm heading over to Flint Hospital next month. And then, like Dr. Andery said just a couple of minutes ago, we go over to Mary Freebed Main Hospital over in Grand Rapids. The nice thing about going in either direction is that they're both right off of the highway, so you don't really have to worry about going through the big cities in order to get to either one of those locations. The Grand Rapids rotation, you do 3 consecutive months, so you don't have to go back and forth all the time. and you do get reimbursement for the travel on any of those out rotations. Can you go to the next slide? So Lansing, I am new here, but it is the capital of Michigan. We've got a really fantastic city next to the college town at Michigan State University. Good college football. Sometimes we get to go as a class. Minor league baseball, lots of sporting events and performances. There's a large international student population, as well as with the different programs here in the hospital. You get a lot of like cultural diversity. It's about an hour to Detroit, Ann Arbor, and Grand Rapids. So if there's a big show, a sporting event, we got all 4 major sports down in Detroit you can go and see. And about an hour and a half to 2 hours away from either one of the big lakes, which I really like to go to with my family. It's only about 3.5, 4 hours from Chicago. Nice big airports out of there if you wanted to do some traveling. Lots and lots of restaurants, lots of coffee shops. I recently went to the MSU Dairy Store, and it's fantastic. I am not from MSU, and this is a hidden gem. Definitely recommend it. Lots of our residents have families, myself included. Some of them have young kids too, and the residency is super understanding and accommodating of anybody that has some of those like that. Low cost of living is a big plus. A lot of our residents have bought houses. A lot of them are investing in that. One thing we are missing, and like myself from Colorado, are the mountains, but we're also missing saltwater. So if you want to go hang out in the lakes, you can do it. Go ahead and do the next one. Yeah, so there's Michigan on the University of Michigan Health, Sparrow on the left. We have the 40-bed inpatient hospital there. MGL on the right. They don't have a rehab floor, but we do a lot of rotations over there. EMGs, consults. You spend a lot of time at either one of those in the Lansing area. And then the next one is McLaren Flint Hospital. They do have a rehab floor there. You work with some awesome attendings and the awesome people over there that really love our residents. And then over at Mary Free Bed in Grand Rapids, they have a full-on standalone rehab hospital with 167 beds. And they're really good people. They really like us over there too.
Hey everyone, I'm Ryan O'Shaughnessy. I'm one of the PGY3s at the MSU Sparrow program. I'll be quickly highlighting the curriculum that we have. A lot of this information we found on our website, so I won't go too far in depth, but as you can see, we are a categorical program, and as such, we have a little bit more say in what our intern year looks like. We try to put as much PM&R focus on our intern year as possible. So some quick highlights here. You can see that we have a radiology month, a rheumatology month, 2 months of neurology, 1 month of inpatient rehabilitation, as well as a month of osteopathic manipulative medicine. We are both a DO and MD friendly program. I'll go over that in a little bit. And even our MDs have a good time on the OMM month. One of our attendings is a lot of injections and EMGs that you're also able to see during that month. And then years 2 through 4, again, you can find this information on our website, but some quick highlights. We have a great diversity to our inpatient and outpatient months. You can see that we do inpatient months both at Sparrow and McLaren, as I mentioned. The benefit of going to both places is that at Sparrow, we're the primary team, whereas Flint McLaren, we are the consulting team on our inpatient unit. So you're able to kind of see, you know, if you're going to work inpatient in the future, how you might run a unit in either setting. We also have multiple outpatient settings, including McLaren outpatient, where you do consults, MSU sports. You're able to work with some of the sports medicine doctors through the MSU clinic, as well as see multiple EMGs. We also, as we mentioned, go up to Mary Free Bed Grand Rapids for 3 months out of our 3rd year. Again, those are our 3 months that are back to back, and you get reimbursed for mileage during those months, or you can use that stipend to rent a short-term apartment if you'd like. And then we use those months to get more focus on spinal cord injury as well as pediatrics. And then during our last year, our 4th year, you get a lot of say in what you get to do. You kind of focus that on getting prepared for your fellowship or your job, whatever you might be doing in your future. Some program highlights. We're a well-established program, started in the early 1990s. We were initially duly accredited with ACGME and the AOA prior to the single accreditation system. As residents, we're both employees of University of Michigan Health Sparrow, as well as adjunct faculty at MSU. So you kind of have the best of both worlds. You get access to both libraries, both research departments. You get all of the resources that you would ever need. Like I mentioned before, we are a categorical program. So along with that more PM&R focused intern year, you also get to build some strong interdisciplinary relationships with a lot of the other services that will be consulting you in the future. One big plus that I like is that we use Epic as our primary EMR on our Sparrow inpatient months, but we also have access to Cerner and Athena for some of our McLaren and outpatient months. And then our primary IPR floor at Sparrow Hospital is located at a level 1 trauma center, as well as a comprehensive stroke center. So we have, lots of great resources when it comes to stroke care, lots of great resources when it comes to polytrauma, spinal cord injuries, and these help you be prepared for your future. Some more program highlights. Every year is paired with a faculty mentor. And so they help you, make sure that you're on the right track, learning what you should be learning in your year. And they're a great resource to have if you've got questions. Our program director who you met earlier, Dr. Andary, has his famous or infamous Andary rounds on Tuesday mornings as a PGY2. It's a great learning environment. You learn along the side of other residents and med students. As you saw previously, we have a strong inpatient exposure as well as strong outpatient exposure, and you get EMG focus all 3 years of your PM&R years. And even if you want, you can get some EMG exposure during your first year. I had a couple EMGs that I was able to get in on during my first year. We've got a strong access to ultrasound guided and fluoroscopy guided injections with our outpatient clinics. And then with our pediatrics department, we have a relatively new pediatrics department. You're able to see OR and sedation procedures. Ian Akers can speak on that regards later if you would like. And then our program is very resident driven. Our faculty are always asking us for opinions on what we want to change, things that we think we can be doing better. We've recently made a restructuring of our didactics. Again, Ian can speak on that behalf if you like, but we're always seeking to improve our program. And then finally, we also take home call, which is very nice. You wake up in the middle of the night, answer the phone, put in a couple orders, go back to bed. You don't have to go into the hospital. It's very nice. And then finally, we have 2 main fellowships associated with our program. The first one is a 2-year sport and spine fellowship, where you work with some of the MSU sports medicine doctors and get to work with the Big Ten sports teams. And then we have a 1-year pain fellowship associated with through Flint. It's a non-accredited interventional pain fellowship. Both are great fellowships that we've had residents go to in the past, and they're doing very well in their jobs now. About 50 to 100% of our residents pursue fellowships. I believe this last year, all 4 residents pursued fellowship. And then some of our most recent fellowships in the last 2 years, we've had pain and interventional spine, sport and spine, cancer and palliative care, pediatrics, and then neuromuscular.
All right, so I'm going to talk a little bit about the didactics program. We have 4 hours of protected time in the morning on Mondays. Our attendings are gracious enough to cover all the floor patients in the morning, so it is truly protected time. The chief residents are responsible for organizing and leading lectures, guest speakers, coordinating the didactic curriculum. And as Ryan mentioned, we are kind of revamping that to have a more structured 18-month cycle as well as a 12-month cycle that's modeled after the board exam blueprint. Additional didactic material or opportunities are with neurology. Every Friday, we have a joint venture where we talk about neuro rehab relevant patients, topics. We present at those and do interesting cases, at least one presentation a year. We also have an intensive anatomy course that we do every year. We have in-depth physical exam and EMG sign-off curriculum, and then we also do a lot of ultrasound and 10x workshops with our sport and spine director, Dr. Safarian. We do get $1,500 for educational stipend that rolls over. You get 2 conferences paid for through MSU for any conference that you have research that's being presented at. We also have an international opportunity in Zambia with a neuromuscular medicine physician, Dr. Kvolson. That's a great opportunity, and if you want to know more about that, we're happy to share that. And then we do a prosthetics and orthotics course as PGY3s. That can be virtual or in person. Importantly, your fellowship interviews don't require vacation. We, as Dr. O'Shaughnessy mentioned, we have a pretty strong osteopathic focus. We have exposure in our internship year as well as our 4th year. Many of our attendings perform OMM, and we do welcome MD applicants, and there have been many happy MD applicants from our program. Some other perks: we get a generous food stipend, about $1,800 annually, and then we get additional food stipends at McLaren in Flint, Michigan. We have access to health, dental, vision, 401k match, 6% match, and then paid time off, gym membership discounts. Many things. We have a personal assistant or concierge service. So if you're in the hospital, you can drop off your car, they'll change your oil. If you need to have your car detailed, they'll take your car and get it detailed, things like that, do dry cleaning, all kinds of stuff. We get generous vacation, 20 days per year, plus recognized holidays, and then additional time off for education, conferences, or if you have to do ACLS training, things like that. So in summary, some of the things that set us apart, we're a categorical program. We get a broad mix of academic, private practice, and community-based learning opportunities, supportive work environment within PM&R Sparrow Hospital, University of Michigan Health Sparrow Hospital, Michigan State University as well. We get a lot of EMG training through PGY2, PGY3, and PGY4. Many of us are signed off on our 200 nerve conductions and EMG studies by 3rd year. And then, like I mentioned, this osteopathic focus. And I'm sure that we also met this PRC Excellence in Healthcare after 2023 as well. So for those who are interested, please apply through VLSO. There's no need to signal the program. If you're auditioning with us, your audition will serve as a signal. You can use that signal elsewhere if you wish. We'll conduct interviews virtually as long as that's the national standard. If you want to come visit for a bit, unfortunately, I think our GME is continuing to not allow visiting folks for like a second look or just independent look at the program, but our didactics are often on Zoom. And so if you are interested in joining our virtual didactics, we can very easily include you, and we welcome you to come and see what we have to offer through our didactic program. If you mention us in your personal statement, that will also be very helpful. I think that's everything I want to say. We have a couple minutes left for questions. Please feel free to speak up, put them in the chat. I'm sure other folks have been going through the chat. We do have some videos with resident testimonies, attending introductions, and facility tours. Feel free to scan those QR codes. We'll make these slides available to people after. Here's our emails. Please reach out if you have questions, things that you want to talk about. We have an Instagram. You can scan that QR code as well. And our website. And then we have a bunch of pictures of us having fun. We didn't have a dedicated wellness slide, but many of us residents go out for trivia on Tuesdays or Wednesday nights. We get together for lug nuts games, the local minor league baseball team. Some of us have gone to Detroit for music concerts, and these are just some pictures from our didactics. having some fun at some parties. This is a picture on the left of one of our past graduates who went to Zambia for the EMG and neuromuscular international experience. And then annually, this is a new thing that's been happening since COVID, is we all get together at one of our attendings' houses for graduation. So we're all a big, close family. And there's Dr. Andary with something on his head. Let's see if there's anything in the chat.
Thank you guys for an awesome presentation. We're actually just running out of time. I do see that you have a few questions in the chat though, so you can feel free to hang back and answer those questions as we move on to the next program. And thank you guys so much again for being here. We really appreciate it.